Now, in Europe, more people die from thrombosis than a combination of road traffic accidents, breast cancer and HIV, despite the fact that it's Ireland's most preventable death. Since today marks World Thrombosis Day, it's the perfect time to raise awareness of what to look out for. And here to tell us a bit more is Professor Fionnuala Ní Aonla, consultant haematologist at the Mater Hospital, and James McDonough, a thrombosis survivor. Good morning to you both, and thank you for joining us on this World Thrombosis Day. Fionnuala, can I start with you then and explain to us what is thrombosis?
Good morning and happy World Thrombosis Day to you all, and thank you for the opportunity to raise awareness of venous thromboembolism. So typically venous thromboembolism manifests as a blood clot in the veins of the leg usually, that can then travel to the veins around the heart, and that is called a pulmonary embolism. And our top message today on World Thrombosis Day is that everybody out there would know their signs and symptoms of a blood clot so that we would never miss an opportunity to save a life. A clot in the leg or a deep vein thrombosis can feel like leg swelling or pain, whereas a clot in the chest called a pulmonary embolism can present as chest pain, coughing up blood, shortness of breath, feeling weak or collapse for no reason. And today, on World Thrombosis Day, we raise awareness of venous thromboembolism so that nobody will miss an opportunity to be treated if they have symptoms or signs that could mean that they should act fast, get their DVT or pulmonary embolism diagnosed and treated, because by doing this we can save lives.
Yeah, and Fionnuala, are they the first signs that you have thrombosis?
Yeah, so typically a deep vein thrombosis or a pulmonary embolism presents very quickly, and seeking advice and attention quickly, getting help rapidly, can save your life. It can happen to anybody at any age, at any stage in their lives, even if they have no risk factors. But there are people who have higher chance of developing a thrombosis than others. And
who are they, and what kind of categories would they be in?
Yeah, so again, what is absolutely staggering is that venous thromboembolism is one of the leading causes of death during pregnancy in the UK and Ireland from conditions arising from the pregnancy. So every single one of our pregnant mothers must be aware of their risk and aware of other risk factors that could increase their chance of developing a blood clot. Also, those patients who are in hospital have a higher chance of developing a blood clot than those who are not. And this is the top risk factor probably at the moment. And this risk can persist for up to 90 days after that person goes home from hospital. And therefore, knowing your signs, knowing your symptoms, acting fast, even after you or one of your loved ones have been discharged or gone home from hospital, could save your life or could save the life of a loved one.
And Fionnuala, is this because... Sorry, the line's a bit bad there. Is this because of just you're not moving around? Is that the problem with it as well? Because when we see people that maybe No, so that's a misconception, is it?
No, as I say, it can happen to anybody, and frequently it comes out of the blue. So we do know that there are circumstances where we need to be more vigilant. So for pregnant women, patients who are affected with cancer, those who are in hospital, but it can hit even young, healthy people who have no risk factors. And that is why today on World Thrombosis Day, it is so important that every single one of us know the signs and symptoms of a blood clot so that we can be diagnosed and treated, and that could save our lives.
And is there anything we can do to maybe try and prevent it?
It's a great question, Alan. So for patients, for example, who are in hospital, we must look out for other risk factors for venous thromboembolism. And those amongst us who are not in hospital as well: pregnancy, having a diagnosis of cancer, having had recent surgery, being in hospital, for a young woman being on the pill or being on HRT. These are all risk factors for blood clots or venous thromboembolism that can increase the chance of having a blood clot. above the baseline risk. But remaining fit and healthy and reducing your body weight and avoiding smoking, these are things that we have control over. But every single one of us must be aware of these signs and symptoms.
Okay. I'd like to bring James in now. Good morning to you, James. So you suffered you suffered from thrombosis. What were the signs for you?
I suppose my incident was back to 2014, just before Christmas, the Christmas week. I was in work and I was complaining I had pains in my lower back. I didn't think too much about it. I thought maybe it was training in the gym or I'd strained it. It was early one morning I woke up and my right leg had swollen massively. It was excruciatingly painful, red to the touch, very, very sore. I didn't initially recognise the symptoms. I wouldn't have known much about DVT, deep vein thrombosis. I went obviously to the hospital then, and I was subsequently diagnosed with DVT. But as I said, my symptoms initially I would have put down to was a sore lower back, possibly around the area of the lungs, which progressed on to the swelling of my right leg, my right limb.
And did you go to the doctor immediately after you found that swelling, or was it like, oh, it'll be grand, it'll go down in a day or two?
Foolishly, I woke up at, I think it was actually 3:20 in the morning. I didn't go straight to the hospital. I should have. I held off a few hours. I don't know why. Maybe I felt it would go down. And it was later on that day in Navan, my own local GP. I went down and I was transferred straight into Navan Hospital prior to, thankfully, being transferred down to the Mater Hospital under the care of Dr. Neonla.
And so you had to have the operation. The operation, Fionnuala, the operations are quite tricky and can be dangerous, can't they?
So again, Alan, the mainstay of treatment for a deep vein thrombosis, and as you can see, James acted fast. He came to hospital, he got diagnosed, and he was treated with blood thinners. And for some people who have, for rare cases where, like James, where there is a huge amount of swelling and potentially threat to the leg, we do use more sometimes other types of therapy. But for most patients, the mainstay of treatment is blood thinners. And as you can see, getting to the hospital fast before that blood clot can cause danger to your life gives us the opportunity to make a diagnosis and to start treatment quickly. Blood thinners can save lives in patients who have just been diagnosed with a deep vein thrombosis or a pulmonary embolism.
And Fionnuala, if people want to find out more, sorry, if people want to find out more, where can they go to? How can they find out more about this?
Thank you, Anne. So the Thrombosis Irish charity, Thrombosis Ireland.ie, is a phenomenal resource. It is established in 2015 to raise awareness of thrombosis and to help patients, to help advocate for people who are affected with venous thromboembolism.
Okay.
And that is a phenomenal resource for our patients. Also, the World Thrombosis Day website has a fantastic array of educational materials for patients.
Well, thank you both for joining us this morning and for highlighting that condition that so many people probably wouldn't be aware of. So thank you for joining us. And for more information and advice on thrombosis, and if you want help to raise awareness, visit www.thrombosisireland.ie.